The 4th of July, you know it's packed with fireworks and food and fun, and whether you're lighting the sparklers or grilling the hamburgers or just hanging out by the water, staying safe makes or breaks the holiday. Whitney Crain, a physician assistant with Cone Health Primary Care and Sports Medicine at the MedCenter Kernersville, is here to talk about how to celebrate safely and avoid that trip to the emergency room, because we all want to avoid that trip to the emergency room, don't we? Okay, let's just start with the first thing that we think of with July 4th. That's fireworks. What's the #1 safety mistake people make, and what injuries do you see as a result of that?
Sure. So first and foremost, maintaining a safe distance, of course, is key. A lot of times we want the best display possible, so we'll light up numerous fireworks and try to light them all at once. But of course, this prevents us from maintaining that safe distance. Similarly, if you have sparklers or something in your hand and again want a giant display, lighting them all at one time increases the temperature and thus increasing the risk of burns. Another thing that we see commonly, of course, you want the most bang for your buck. If you have a firework that only partially goes off, please do not try and relight that. It can explode at any point in time, thus increasing the risk of injury. Duds are one that doesn't go off initially. Also, please do not try and relight. Always try and have a safety or backup plan, have a bucket of water or a hose, just in the case of injury or a fire. Common injuries, of course, we're dealing with something hot, so we see burns all the time. 60% of those usually include the hands, the fingers, the face, or the ears.
Yeah, I can imagine so. Okay, so the staple for 4th of July, every kid I've ever known has grown up with them. We probably had it too, the sparklers. Let's talk about safety for kids and sparklers.
So sparklers, while they look harmless, should not be used in children under the age of 5. Believe it or not, sparklers actually burn at very high temperatures, reaching all the way up to 2,000 degrees Fahrenheit. So if you can imagine a small child grabbing that, high risk of burns. Little children also don't have the fine motor skills or the dexterity in their hands to hold such a small little sparkler, and thus increasing the risk of grabbing it at the wrong spot or burning their fingers. Safer alternatives to that would be glow sticks. What can you do if the sparklers are around to prevent a little one from grabbing that? You can have a bucket of water, and after it's done burning, rather than placing it on the ground, put it in that bucket of water, again, to remind that little child not to grab that high temperature object.
All right, with that being such a big thing, you know, the heat and the burns and things of that nature, what can we treat at home, and what needs medical care if someone were to get hurt at our 4th of July party?
Sure. So many burns can be treated at home initially. A common misconception is you just burned yourself with something hot, so let's rush it under cold water or place ice on it. But the problem is actually using some cold temperature can further damage the tissue underneath of it. So we'd request that you use room temperature water and a mild soap like Dove, and just scrub, trying to remove anything that could have been contaminated in that wound. After cleaning the wound, we'd recommend using some type of either Bacitracin and antibiotic ointment or a Vaseline. These act as barrier creams and prevent anything from getting inside of it. They also provide moisture. In the hands, the arms, the legs, any potential area that could be contaminated, you can then cover it with a non-stick pad, again, just to prevent any infection. Sometimes, unfortunately, burns can lead to the urgent care or emergency room. If you have a 3rd-degree burn, these are much more serious. They involve all layers of the skin. And commonly, you can tell just by looking at the skin if it looks white or charred or leathery in appearance. Sometimes that can indicate it's a deeper burn. If there's signs of infection, pain, redness, swelling, warmth, drainage, these would be signs that a burn needs some further medical attention. And then lastly, any burn that involves a large surface area or a large portion of the body, we would recommend medical attention.
That's a good thing about the whole not ice on the burn, because I think we were all told to put something as cold as you can on that burn. So I'm glad that you clarified that. Let's talk about grilling. It is, of course, a July 4th tradition. Let's talk about some safety to preventing fires and for getting things out of control.
As far as grilling?
Mm-hmm.
Yes, yeah. So when it comes to the grill, of course, having a well-ventilated area is important. Obviously, the weather can take a turn for the worse, and so if you try to move it indoors, please make sure that there's some form of ventilation to prevent not only a fire, but also a respiratory or an inhalational injury. If grilling outside, making sure that the tree branches or bushes are not too close to the grill. Keeping children away from the grill. Of course, we don't want little hands getting close to such a hot object. long utensils or spatulas, tongs. These can help you to flip your food without risking a burn on the forearm. And then lastly, making sure that you're cleaning your grill on a routine basis, of course. If there's a lot of grease, that can lead to grease fires. So cleaning the grill, removing the grease traps, this would be helpful.
Yeah, we've all had that flame up on the grill, and you definitely want to avoid that. All right, so what we're going to do is we're going to take a quick break. We're going to be back with Whitney Crain. Coming up, we're going to talk about some water safety. We'll see you in just a few minutes.